1 in 4 teens who use alcohol or illicit drugs or legal medications to treat pain will develop dependency, a rate dramatically higher than any other age group. It's important that parents know what factors can lead to substance abuse by their children and how to spot problems at an early stage when they can best be treated. Research over the past 2 decades has tried to determine how drug abuse begins and how it progresses. Many factors add to a person's risk for drug abuse, but most individuals at risk do not start using drugs or become addicted. As with many other conditions and diseases, vulnerability to addiction differs from person to person. Genes, mental illness, family and social environment all play a role in addiction. Risk factors that increase a person's vulnerability include a family history of addiction, abuse, neglect, or other traumatic experiences, mental illness such as depression and anxiety, early use of drugs, and how the drugs are used. Smoking or injecting a drug may increase its addictive potential. Some risk factors may be more powerful than others at certain stages in development, such as peer pressure beginning during the teenage years. Being friends with drug-abusing peers is often the most immediate risk for exposing adolescents to drug abuse and delinquent behavior. Other factors, such as drug availability and beliefs that drug abuse is generally tolerated and acceptable, are other factors that can influence young people to start using drugs. I've been a pediatrician for over 25 years, and I know that parents are the strongest influence that children have. This influence decreases during adolescence as peer pressure grows, but you continue to have a major impact on your teen's decisions. Prevention starts when you start talking and listening. Spend time with your teen and listen to what your teen has to say. Talk honestly with your teen about healthy choices and risky behaviors, and provide clear rules and guidance about not using alcohol and drugs. Tell your teen that you love them and you are concerned about their safety. Tell them that frequently. Know where your teen is going and who he or she will be with. Get to know your child's friends and their friends' parents. Some parents have a misguided belief that underage drinking is normal and actually tolerate drinking in their home. Be clear and consistent about your family rules. Doesn't matter what other families decide. Your family rules show what your family believes is important. Some of the warning signs associated with abusing drugs or alcohol include isolating themselves from your family, an extreme shift in mood, a change in their circle of friends, a family history of alcoholism or drug abuse, taking risks. Other warning signs include declining grades, using street or drug language, a diminished interest in hobbies, and a lack of appreciation for your family values. Adolescence can be a tumultuous time. Talking and listening is important, but sometimes this is a challenge for teenagers and their parents. It is important that your teen have an open and honest relationship with an adult that can assure confidentiality, and your teen's primary care physician is a good place to start. You might want to ask your child's doctor in advance if he or she is comfortable screening for drug use with standard assessment tools and making a referral to an appropriate treatment provider. If not, ask for a referral to another doctor skilled in these issues. You can also contact an addiction specialist directly. 2 good resources are the American Society of Addiction Medicine and the American Academy of Child and Adolescent Psychiatry. Both websites have a Find a Physician feature. You and the physician you choose can decide if your teen needs treatment. It takes a lot of courage to seek help for a child with a possible drug or alcohol problem. There's a lot of hard work ahead for these families. But treatment works and teens can recover from addiction although it will take time and patience.